This lecture is on symptoms and damage associated with COVID-19. The list is long. So, symptoms include fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body aches, headache, new loss of taste or smell. The loss of smell is particularly characteristic in some. It's known officially as anosmia. You may get a sore throat, congestion or runny nose, nausea or vomiting. We have ACE2 receptors in our digestive system. Diarrhea, new confusion, inability to wake or stay awake. The confusion, the waking, and so on may have to do with low blood oxygen levels. So new confusion, inability to wake or stay awake, bluish lips or face, again, low blood oxygen. COVID toes, which is a splotchy appearance in the toes due to blood clots. Remember, we have ACE2 receptors in the linings of our blood vessels. This can lead to blood clots. This can be a problem. This is just one kind of characteristic symptom. Likewise, we can get blood clots in our skin. That's fairly common. And problematically, not everyone gets the expected symptoms. This is why people actually have to be tested if they suspect that they have the disease, or if they even think they have been exposed. So this is part of what makes COVID-19 so bad. It attacks so many different parts of the body. And the mortality, the actual death rate from this disease, the mortality rate for COVID-19, and I'm going to say in the US, because this varies from country to country, is 2.4%. That means that for every 100 people, who get COVID-19, .4 people will die of it. And this rate only applies to the USA. Different countries have different success rates. Okay, now another problem that we have with this disease is its contagiousness. This is what really tends to get us. Since each person who gets the virus will, on average, give it and infect another 2 to 3 people This adds up to basically a lot of dead people. And many more sick people. If it is left unchecked. That is why we go to so much effort to check it. So take a look at this. What you have there is an exponential relationship. When you have doubling or trebling of anything, then it can seem, the numbers can seem very insignificant at first, but they can become overwhelming not long thereafter. And one thing which is peculiar about this is that this is strictly an average. It turns out that with this particular virus, you may have some people, particularly people who then self-isolate, who do not give the virus to anybody else. But on the other hand, you will have other people who will wind up giving the virus to dozens or even hundreds of people. So among all these people who get the disease, then, about 10 to 15% of people who get COVID-19 get severe disease. They'll have to be hospitalized. It's the kind of thing where if they weren't hospitalized, they would risk death, and they are in any case extremely sick. And then 5% can become critically ill, even more sick, basically. And another serious problem then is long-term damage. Long-term damage then may persist. Even if you don't die of the disease. And oddly, this is true even for some mild cases. You may have people who felt sick but not too sick, but the damage goes on for the rest of their lives. So I'm going to get a little bit more now into some of the more specific problems that people can have. So we have problems during infection. And subsequent long-term damage then can include, first, acute respiratory distress syndrome, also known as ARDS. So this then involves widespread inflammation of the lungs. And this then leads to less oxygen entering your bloodstream and reaching your cells. So now you've got low blood oxygen levels. And so this lack of oxygen then can cause damage to many organs. Including the brain and the kidneys. And ARDS can lead to long-term difficulty in breathing due to damage to the lungs. So that's ARDS. Another problem that you can see then is blood clots. So blood clots then often develop in people with COVID-19. This can be a problem for treating people because these blood clots can appear in medical lines and catheters. By medical lines here, I'm talking about, for instance, intravenous lines, just so you know what I'm getting at here. You can also have blood clots then that may appear in arteries, lungs, kidneys, extremities, including the toes. Remember, I talked about COVID toes already. And in the cerebral, that is to say, your brain's arteries. Once you start getting blood clots, you've got problems. So there will be long-term damage. Actually, I'm going to say long-term consequences. Let's put it that way. There will be long-term consequences to some of these blood clots. Such as those in the lungs, heart, and brain. These particular ones then cause some things you may have heard of. Pulmonary embolisms. That's from blood clots in the lungs. Heart attacks. That's from blood clots in the blood vessels in your heart. And strokes, which are basically in the blood vessels that provide blood to your brain. With all three of these problems, the cause is the same. It's a blood clot that has broken loose and it has floated through the bloodstream and lodged in an artery, thereby blocking some of the blood flow through it or blocking all of the blood flow through it. And that then means that the cells that are downstream are deprived of oxygen and they wind up dying. And so all three of these different diseases, these things or these problems, pulmonary embolisms, heart attacks, and strokes, they're essentially the same thing in different places. It's a blockage of an artery leading either to problems in the lungs, or because the artery is in the lungs, I should say, or blockage in the heart leading to damage in the cells of the heart, or blockage in the blood vessels in the brain, leading to the death of some brain cells. It's essentially the same problem in three different places. But there are other kinds of heart damage you can have as well. So, heart damage. This can also take place in other ways besides having a heart attack. So this can also take place then including inflammation. Here we are back with inflammation again, including inflammation and damage to the heart muscle itself. And remember, the heart is one big muscle that contracts and pumps your blood. So you damage the muscle, you're in trouble. Again, so you can also have inflammation and damage to the heart muscle itself. And this then is known as, I'll do it down here, myocarditis. But you can also get inflammation of the covering of the heart. And this is known as pericarditis. The word itself tells you what's going on. Card has to do with heart. Itis is some kind of an inflammation. Peri means around. So these can occur by themselves or in combination. It just gets worse and worse, doesn't it? And heart damage, then, may be an important part of severe death and disease from COVID-19. And heart damage like this might also explain some frequently reported long-term symptoms like shortness of breath, chest pain, and heart palpitations. And here is one thing that is very troubling. We have now seen young adults with COVID-19, including but not limited to athletes, can suffer from myocarditis. Remember, that is inflammation of the heart muscle itself. And severe heart damage has occurred in young, healthy people. Though this is rare. We also see problems with the brain and the nervous system. So, as said before, there is the loss of the sense of smell. Which is a well-known symptom. This loss is sometimes long-term. Even after the person has recovered from the disease. Another potential long-term brain and nervous system problem, then, is just plain cognitive impairment. For instance, impairment of memory and or concentration. You can also see some long-term musculoskeletal problems, primarily pain in joints and muscle. Other long-term problems then include fatigue, just general overall fatigue. In children, we see a separate subset of problems. There is a risk of contracting what is called multi-system inflammation syndrome, or often MIS. And children can develop severe inflammation affecting multiple organ systems. Many of these children develop cardiovascular and clotting problems and have gastrointestinal symptoms. And a high proportion then also get skin rashes. These are basically probably mini clots from in the blood, and long-term damage may result because of all of these features. And perhaps scariest of all is something that we are now running across called long haulers. Because basically a small but significant proportion of the people who contract COVID-19 become what are called, that's a quotation mark there, become long haulers. That is to say, people who have symptoms or long-term effects even after they have recovered from the infection itself. And these lingering symptoms, then, I will say lingering effects, not lingering symptoms, but these lingering effects. These lingering effects include lung, heart, and nervous system impairment. And survivors may be left with scarred lungs, chronic heart damage, post-viral fatigue, and other persistent debilitating conditions. And for those who are going into healthcare, keep in mind that these people may be your patients even after the pandemic is over. I suspect that rehabilitation from the effects of COVID-19 may be, well, a long-term new field of medicine. And that's the end of this lecture.